What is hantavirus? Hantavirus is not one virus. It is a family, a large family, like influenza, but quieter. The main group is called orthohantavirus. Within this group, 5 to 10 strains cause most human disease. All of them share one source: rodents, mice, rats, voles. The animals carry the virus for life, never sick themselves, always shedding it. Humans are accidental guests. Until the 1990s, scientists believed no hantavirus spread person to person. Then, around 1996, the Andes strain in Argentina proved otherwise. First documented in 1996, first small outbreak in 1998, then again in 2002, 2010. Always small, always contained, but always possible. How is hantavirus transmitted? The primary route is respiratory. Dry mouse droppings, dry urine, dry saliva. Sweep them, the dust rises, you inhale. That is the classic path. But Andes changed the rules. In 1996, Argentina showed it could pass from human to human. Not easily, not quickly, but in close contact, prolonged exposure, especially during the early symptomatic phase, it happens. The infected person is most dangerous just as they begin to feel ill, before they know what they have. Hantavirus. How do symptoms begin and progress? Every hantavirus infection begins the same way. Prodromal phase, 3 to 5 days of vague illness, fatigue, muscle ache, mild fever, runny nose, ordinary, unremarkable. Then the virus chooses its target. In the Americas, Sin Nombre and Andes strains attack the lungs. Capillaries leak, fluid fills the alveoli. The patient drowns in their own blood plasma. This is hantavirus pulmonary syndrome. Mortality, 30 to 50%. In Europe and Asia, Pumala and Dobrava strains attack the kidneys, distal tubules. Capillary leakage causes hemorrhagic fever with renal syndrome. Bleeding, shock, kidney failure. Mortality, 1 to 15%. Slower than the long form. More time to intervene. What is the incubation period for hantavirus, Andes virus? For Andes and other American strains, incubation ranges from 5 days to 6 weeks. Most cases appear between 5 and 12 days. In outbreak settings, nearly all symptomatic cases emerge within 3 weeks. The 6-week figure is rare, documented in isolated cases. For European strains, the range is narrower, 2 to 4 weeks, with kidney involvement beginning around the 2nd week. The World Health Organization recommends 42 days of isolation for high-risk contacts. This covers the maximum incubation with margin. Not because the virus spreads easily, but because when it does, the outcome is severe. Hantavirus. What is the mortality rate? Andes strain, 30 to 50%. This is among the highest mortality rates for any acute viral infection. Sin Nombre, another American strain, is similar. The Old World strains are less lethal, but still dangerous. Pumala, 1 to 5%. Dobrava, 10 to 15%. The difference lies in speed. Pulmonary syndrome kills in days. Renal syndrome kills in weeks. Both begin with the same 3-day cold. The divergence happens suddenly. This is why early recognition matters. By the time the lungs fill, it is often too late for intervention. Is there a confirmed treatment? No approved antiviral exists. No vaccine is commercially available. Ribavirin, a broad-spectrum antiviral, has been tried. Limited benefit, only in early prodromal phase, primarily for the Old World kidney form. For pulmonary syndrome, ribavirin shows no clear efficacy. Supportive care is the standard. Mechanical ventilation, fluid management, hemodialysis when kidneys fail. Research continues. mRNA technology, monoclonal antibodies, neutralizing antibodies. The same platforms that advanced hepatitis C treatment may one day apply here. But for now, prevention is the only cure.
Is ivermectin effective? No. The mechanism does not align. Hantavirus damages microvascular endothelium. The body's own immune response overreacts, attacking infected cells, causing capillary leakage. Ivermectin is an antiparasitic agent. It does not inhibit viral replication. It does not modulate the immune cascade. It does not stabilize capillaries. The idea originated during COVID-19, when ivermectin was proposed for multiple viruses without mechanistic rationale. For hantavirus, there is no in vitro evidence, no animal model success, no clinical trial data. Biology is not politics. The virus does not respond to belief.
Virus spread in the ship incident. The ship outbreak began with a single passenger, a Dutch citizen traveling in Uruguay and Argentina before boarding. He was asymptomatic at embarkation, incubating, the virus silent inside him. Days into the voyage, he developed symptoms. Prodromal at first, then pulmonary. During this early symptomatic phase, he transmitted to approximately 8 to 10 close contacts, family members, cabin neighbors. The ship was not the source. The mouse was not on board. The passenger brought Andes virus from land during his travels. This fits the known biology. Human-to-human transmission of Andes requires prolonged close contact and is most efficient in the early symptomatic window. The outbreak was identified, contacts traced, chain contained. No pandemic potential, but a clear demonstration of how one traveler can reintroduce a forgotten threat.
Quarantine and isolation. The World Health Organization issued its first quarantine recommendation for hantavirus on May 9, 2024, specifically for this ship outbreak. The logic came from a 2018 Argentine cluster, where an asymptomatic carrier attended a birthday party and infected multiple guests during early symptom onset. The strategy divides contacts into two tiers: low risk, self-monitoring, no isolation; high risk, 42 days of quarantine. This reduced the reproduction number from approximately 3 to below 1. Not blanket lockdown, precision public health. For the ship, passengers who disembarked earlier were low risk. Those remaining aboard until final evacuation were high risk. Most countries followed WHO guidance. Some, including the United States, did not impose quarantine on any tier. The virus does not recognize policy differences.
What should we do to protect ourselves from the virus? Prevention is mechanical, not medical. First, never dry sweep a storage room, barn, or any space where rodents may live. Wet mop. Dampen the dust before disturbing it. Wear an N95 mask. The virus is in the air only when the dust is airborne. Second, inspect food and drink packaging. Mice climb. They urinate on surfaces. Cans, bottles, boxes stored in warehouses or depots may carry dried urine on lids. Wash before opening. Use a glass. Do not touch the lid to your lips. Third, rodent control. Seal entry points. Trap. Do not poison. Poisoned mice die in walls, attracting insects and secondary infections. Trapped mice are removed intact. These measures protect against more than hantavirus: leptospirosis, Lassa fever, rat bite fever. The rodent reservoir carries multiple threats. The solution is the same: deny them access, deny them contact, deny them the chance to share what they carry. Hantavirus is not the next pandemic. It lacks the transmissibility, but it possesses something worse: stealth, severity, and the patience to wait in dust. The smallest creatures,
in the quietest places, carry the heaviest death. Read your surroundings before they read you. Subscribe for the next reading and leave your comments. Thank you so much for watching. Your body is speaking.